today I want to talk about the Ferber Method. Now, the Ferber Method is a technique that's been touted as being effective in getting infants to sleep through the night. Now, before I begin, let me state that this method is controversial and is not recommended by all pediatricians. The Ferber Method asks the parents not to comfort the infant right away when he or she is crying, but to allow the baby to cry for 5 minutes or so before comforting him or her. Then the parent is asked to gradually increase that time frame and say 5 minute increments. Now, there are many variations of this method. Variations go by other names such as graduated extinction or crying it out. Now, the theory is that with time, the baby will eventually stop crying and go to sleep on his or her own without parental intervention. Now, they call this phenomenon self-soothing, and don't ask me what that means. I have no idea. Self-soothing, it sounds like Vince Lombardi telling the kid to get tough and stop being a crybaby. Or it's just a clever word so that the parents can feel better about themselves. Now, recently, Barack Obama and his wife Michelle were in the news, not because of their supposed impending divorce, which is, of course, something the media has decided that we must know about, but because of their difference in parenting techniques. Barack wanted to try the Ferber Method. This was many years ago, which, as I have stated, is a behavioral modification technique employed to help babies and infants sleep through the night. And Michelle was reluctant to try this method. So I suppose we should talk about the Ferber Method and what it's all about. Now, I can't say that I'm an expert on this, but I'm going to try to guide you through this in a common sense way. Well, let's start with some realities regarding children, infants, and babies. Now, I'll talk about 10 of them, and they're kind of like the 10 Commandments. So this is me talking to you, the parent. Number one, when you have a child, your life as you know it is over. Your new life begins. Number two, you're never going to sleep well again. Number three, your baby is a separate human being. Your baby is not you nor an extension of you, nor is the baby your other child or another child. Number four, you have to ask yourself what getting the baby to sleep is all about. Is it about the baby or is it about you? Number five, babies are going to act out of their own self-interest. They're going to do what they want to do, and what they want to do is what they want to do. And if they want to stay up all night, that's what they're going to do. Number six, once you accept these points, which I've just discussed, you will be able to deal with a crying baby more effectively. Number seven, when the baby cries, turn your emotions off. Get up like an automaton, walk over to the baby, console the baby or pick the baby up and comfort the baby until the baby falls asleep. Then robotically put the baby down and return to your bed as if nothing ever happened. Don't even think about anything else. Empty your mind of thoughts and emotions. Number eight, babies cry for a reason. Now, most of the time, less than 4 months of age, it's colic. After that, and even before that, it could be anything. You have to find out what it is. Number nine, in the long run, it's not going to matter whether you use the Ferber Method or not. Using or not using the Ferber Method is not going to be a life-altering event. Your baby is not going to grow up to be Adolf Hitler because you did or did not use the Ferber Method. Now, your baby's a lot tougher than that. Number 10, and I say this tongue-in-cheek, there's not an ounce of science behind any method in getting babies to sleep. Nobody knows a baby's mind or can even remember being a baby. Okay, so what would I do if I were the parent of a baby who was crying? Would I use the Ferber Method? Well, first, I would want to know what's going on. I would pick the baby up and examine him or her. Does the baby have a fever? Are there any little hairs wrapped around the toes? If it's a boy, is the foreskin pulled over the head of the penis in the normal position, or is it retracted and choking off the head of the penis like a rubber band? Is there any pus coming out of the ear? Are there any sores in the body? Are there any unusual lumps that might be tender? What does the skin color look like? Does the baby have good muscle tone? Is the baby's cry weak or strong? Is the baby cold? I would hold the baby and comfort the baby. I would accept the fact that this is my new life and that my new life is far more interesting than my old life. If I had a boss who would scream at me because I was losing sleep by devoting too much time to my child, I would tell my boss to go to hell. No, I'm joking. I don't want you to lose your job. Now, on the surface, the Ferber method comes off to me as something that was designed by J.P. Morgan and Associates in order to produce more productive employees. But does it work? Well, I don't know. Professors claim they have studies that say it does, although I can't find any controlled studies on the internet that I can review. But let's say that it does work. So what? To me, it seems as if the Ferber method trains babies to tough it out, to not be a complainer in life. In that respect, it does not address why the baby is crying. So it's a very Spartan approach. One problem is that many parents may not be willing to allow their baby to cry. Not everyone has the strength of Taurus bulba. Another thing that needs to be understood about babies and infants is that they're not adults. Their nervous system is in development, and it takes time for that nervous system to mature into adulthood. Babies are naturally much more irritable and sensitive than older children. Babies, as you well know, cry for everything. That's how the term crybaby came about. It takes time for the baby's nervous system to settle down and not be as irritable and reactive as it is. Biologically speaking, you can notice this in other species. For the past 30 years, I've had many feral cats around my house. When I approach the adult cats, they hardly move until I get about 6 inches away from them, at which point they move away quite easily. I've never been able to catch one, and they seem to know that I can't. The younger kittens don't understand that yet, that they can easily outrun me, and they're always scared. They're scaredy cats. So if I get within 10 or 15 feet of them, they start running like mad to the neighbor's yard. Now, with time, though, as they get older, they settle down, come to understand that they can get close to me without me doing any harm, simply because they can outrun me. Plus, they're quicker than me. But this takes time for them to get to that point. In that regard, human beings are not much different. It takes time for babies and infants to settle down. We can't expect them to behave and sleep like adults. We have to ask ourselves why the baby is crying in the first place. Well, there could be many reasons why a baby might cry, as I've stated above. Maybe they're just cold. Frequently, I've examined babies in my office. When they come in, they're fine. After I remove the blanket to examine them, after a few minutes, they may start crying. When I put the blanket back, they calm right down. Or it could be that the babies just feel like complaining for the fun of it. We all know adults who are complainers. Maybe this is a future opinionated person who likes to speak out. Maybe we are seeing the evolution of the next William F. Buckley. Either way, the baby is crying for a reason. It's important that we try to find out what that is. Now, imagine if you, the adult, the parent, were a quadriplegic dependent upon an aid for everything, and you woke up in the middle of the night and had a headache, an itch on the nose, a cough, or any other number of maladies. Wouldn't you cry out for assistance? Of course you would. Suppose the response you got from your caregiver was the Ferber method. How would you feel about that? Sure, you would learn not to call out for help, but would your needs have been met? No. Another thing is this. We don't want to get into the boy who cried wolf situation where we get complacent about the baby crying. Now, with all that stated, my first preference would be to console the baby, and I would try to have perspective on this problem of waking and crying. And this is what I ask you to understand. This problem is not going to be there forever. Someday your child is going to grow up and leave the house. And you might be wishing for the opportunity to go back in time to the days when you could hold your baby. Ultimately, though, your choice as a parent is going to be influenced by who you are as a person and what you believe in. If you are King Leonidas leading the troops into Thermopylae, perhaps the Ferber method is for you. Thank you.